Hi, my name is Sabrina Warden. I'm from Houston, Texas. My mentor's name was Dr. Alexander Erickson. The goal of my presentation is to understand how a numbing medicine called stellate ganglion block can be used for treatment for PTSD. So, a little bit of background about PTSD. It is known as post-traumatic stress disorder. It was originally coined the term as shell shock, soldier's heart, and combat fatigue due to how many rising cases of it occurring in U.S. veterans. U.S. veterans have the highest number of PTSD cases, which is 7%, while in the general population only occurs in 6%. In the DSM-5, it is under the category of stress and trauma, and it can be diagnosed through clinical interviews and assessments. There are four clusters and symptoms of PTSD. The first one is intrusive, having nightmares and restless nights and unwanted memories. The second is avoidance, which is resisting conversations with people, places, and things that might attract that traumatic event. The third is heightened arousal, which includes restless, aggressiveness, and trouble falling asleep. And the last one is in changes in thoughts and thinking, having feelings of guilt, shame, and disinterest. To be diagnosed with PTSD, a person must have at least one of these symptoms. So what treatments are there for PTSD currently? Currently, there are three different types of therapies: prolonged exposure therapy, which is the least effective therapy currently, and cognitive processing therapy, which is the most effective one. Cognitive processing therapy only helps around 53% of people, and that's only about half of the people that have PTSD. So there leaves no solution for the other half of patients with PTSD. So what is stellate ganglion block? Stellate ganglion block is an FDA-approved injection that is inserted in the cervical area that is used for chronic pain in the upper extremities. That includes neck pain, back pain, and arm pain. It is used to diminish that pain in the area to reduce the chronic pain there. It also informs the amygdala and hippocampus to be calm, which can reduce negative thinking and emotions, which is associated with PTSD. It's a procedure that takes a maximum of 30 minutes, and it's a one-time used injection. So PTSD was originally FDA approved in 1925 for PTSD. Then it was used in 1945 for treatments for depression lab research. And then it was used in 1998 for PTSD by Finnish doctors. And then in 2010, two military doctors used it for veterans who had chronic pain and PTSD and saw it as a two-in-one combination injection for both of them. So Dr. Eugene Lacroix, who is a pain medicine specialist, describes PTSD as a psychological process that needs help like a broken leg, and he uses this to emphasize how PTSD is a multiple component for SGB and it reduces the stigma behind PTSD. So the project goal was to understand how stellate ganglion block addresses the flight and fright response that PTSD gives. They both help reduce pain in the amygdala and hippocampus, and the SGB will reduce pain in the chronic pain, and PTSD for the pain in negative thinking and alterations, and how SGB would also relax the nerves there. So what research methods did I use? I used search publications and talking to veterans. I searched keywords that have stellate ganglion block, PTSD, randomized control tests, and veterans. And I also talked to veterans to help reduce the stigma behind mental health and seeking help for PTSD. So I found two case studies, which they both found successful of using stellate ganglion block for PTSD, which a 46.3 reduction rate in one and 56 reduction rate in the other. And they both found that talk therapies were unhelpful for them. So using stellate ganglion block reduced those symptoms dramatically. I also found two tests, one with the placebo effect, which also found that there was a negative 12.6 decrease in PTSD even with that. And the other one found that there was a 70 to 75 improvement in symptoms of PTSD, which shows that it was higher than the improvements with therapies. So what's next? So I also talked to veterans, and I'm still talking to them and talking about the stigma behind PTSD and how seeking help is not a sign of weakness, it's a sign of strength rather than when finding that it improves, that finding drugs that improve PTSD symptoms. So some critiques from the test, though, that I found that there was a stigma behind PTSD. There was also a lack of research behind this drug, that this help does not including having it FDA approved for them, though. So in conclusion, I collected and analyzed how stellate ganglion block not only helps patients with pain, but PTSD, so it can be FDA approved. It can also be FDA approved, so then therefore it can be used more commonly for PTSD. And a suggestion for veteran health affairs would be conducting mental health screenings to help promote this drug and helping veterans find a solution for their PTSD symptoms. And these are my resources. Thank you very much.